Absolutely.
It's been quite a while.
And thank you for coming down to Carlow.
Oh,
yeah.
Tell me a bit about you, dentistry, and just how you got to where you are today.
Okay. I am a Carlow girl. I went to school in one of the big schools here, excellent girls' school, Leo's. Decided early on, I'm a very fiddly person. I like really intricate
stuff.
Yeah. Crochet was one of my chief hobbies when I was younger. So decided then really wanted to do something in a caring profession. Had spent quite some time in the dental chair as a child, and I thought, I'd like to do that. So off to Trinity, off to the UK for a while, and Pembroke, as it was the practice I used to come to as a child. It had
This practice?
Yeah.
This site?
Not this site,
Okay.
the original Pembroke.
Okay.
It was a great practice, seriously good dentists. The opportunity came up to take it on. I was 27, I think. 27.
Good God.
Yeah, at the time. So I was the first female dentist in Carlow, and the perceptions to start off with were, the perceptions were: was I up to it? Was I too young? I had patients who were very kind now to me, but some of them were sort of saying, "Are you just too young?"
But do you think, as a 27-year-old female dentist, having qualified, been to the UK and coming back, do you think you had something different to offer or something more to offer? Did you have more experience than maybe your contemporaries around town?
Yeah. Techniques. It was a big, huge leap had taken forward, had come in the dentistry world. It wasn't all about, the caring part of dentistry came out. Patient care, first of all, that was what we were taught. It wasn't about the individual tooth, fixing that in isolation from the rest of the patient. It was about looking at the patient as a whole, what were their needs, what were their concerns, and taking it from there.
But the business of Pembroke Dental Clinic, it's now changing and evolving to really become, you said you were interested in health. So as I see it, it's really about becoming a health centre.
Yeah.
Isn't it?
Yeah.
What other services do you currently offer?
Okay, well, I really felt that there was a need for other specialised dental services here as well. So first of all, teeth straightening is a huge issue, not just from a cosmetic viewpoint, from a health viewpoint. So we have 2 orthodontists here. We have a specialist dentist called a prosthodontist, and what she does is that she really rebuilds people's mouths using dental implants. Then we have specialists called endodontists who do specialist root treatments. We've oral surgeons then who take care of, say, difficult extractions, wisdom teeth extractions.
But even beyond dentistry.
Completely.
So even beyond dentistry, because I saw on the board outside there's a podiatrist on site.
That's exactly, yeah.
And there's another lady who's doing some nice aesthetic work.
Yes, indeed, yeah.
So that's 2 quite different additions, isn't it?
Yeah. So podiatry, podiatry is the feet, care of feet, and then we have a physical therapist here as well who keeps us all going.
Wow.
Niamh, and then, as you say, we have the skincare element as well. So the facial aesthetics is the other name for it. So
why? I'm sort of intrigued by that.
Okay.
I have to say.
Yeah.
Because it would not be traditional for anybody to walk into the dentist and say, "Could you please sort out my frowns and my crow's feet?"
Yeah.
Why? What was that about?
Well, it actually started, I went on the course, I'm doing this for about 10, 15 years now at this stage. Fell into it a little bit sideways, but then actually realised that, sometimes a little bit of help with some Botox or fillers can absolutely transform somebody's life. I mean that. And there are people who you've done lovely orthodontic work, cosmetic dentistry, but their lips just need a little bit of help, so lip fillers are great there. I really enjoy it. I give injections all day long, and it just becomes very, very easy and very natural, and it can be just the finishing touch. When you've done lovely dental work, that can be just the icing on the cake.
Do you think there's a difference in going to a certified doctor to have your fillers and your Botox as opposed to your beautician down the road who might be offering the same, who might be offering a similar service?
Hugely. The one thing I'll say about myself when I'm doing is that I will be very honest whether this thing will help you or not. And really things have to be done you know, in a very sterile environment. People really have to know what they're doing. If it's all fine if it goes right, but if it goes wrong, you really need to know what you're doing. It's not simple.